This is the official launch for Operation 2020. Our goal is to eradicate vitamin A deficiency on the planet by the year 2020. India and the big cities in India make the cities in the U.S. I grew up in New York, and I always thought New York was teeming with life. When you come to India, New York looks like a sleepy town. We've been in India for over 12 years now. Vitamin Angels has been working throughout India. It's people everywhere you look. There are people. So the people are lovely, and it's thick with humanity. Our mission is to provide vital nutrition to children in need. We understand that nutrition is the foundation of good health. I'm here today on behalf of the children who are here and the children who could not be here, the children who need our help. We originally started with 250,000 children. We're now reaching 1.1 million children in India. Last year we reached 5.5 million children around the world in 17 countries. This year we'll reach 7.5 million children. Around the world, 140 million children are affected every year. For those children, they can lose their eyesight, they will not grow to the proper height. Every infection that comes around, they'll get sick, they're at risk of dying. We see more childhood blindness in India than anywhere else, so we know the problem is acute here, and we know that with the right resources that we can get to the children who need it the most, which are the poorest children, the children who are medically underserved, and the children living in rural areas. And these are the children we're here to help. The vitamin A and the deworming that we're going to be doing today is going to help make you healthier. Each of you has a gift that the world needs. And to give that gift, you have to be healthy. If you're healthy, you can learn. And if you can learn, you can fulfill why you're here. The program in India is immense. You have to realize that India has 24 million babies born every year. The scope is just, it dwarfs anything else. She shouldn't be this small.
Yeah. That's what I used to do.
This is 6 years old?
6 years old.
Yeah, that's too small.
Ado.
This is Ami Ado. This is this little girl is 6 years old. She's way too small for her age. You can see the level of malnutrition in these kids. You can see where it's passed on from generation to generation. I mean, the mothers are really small. You're hearing a lot of coughing. We're seeing, eyes that have already starting to have poor vision. Skin tone is really poor. I mean, you're already seeing a lot of the problems. This is like a population that we need to reach, and these are the ones that will have the greatest results. We know that a key part of having a happy life is seeing your children be healthy, which is why we're here today. This is one of 54 islands off of Calcutta. There are about 10 to 15,000 people on this island, so it's a pretty big population. I think probably the water might be the biggest problem, is contaminated water. And any latrines or toilets or no?
Pardon me?
Toilets?
Here? No.
Yeah.
It's open place.
Open place. Yeah. No toilets.
No toilets.
No clean water.
Yeah.
No medical help. No school.
No schools.
In Nandapur, this is the water source. Most families have a much smaller one, but this is where they're doing their drinking. This is where they're doing their laundry, where they're washing, dishwashing, I mean everything. And the water is not clean, and that's one of the reasons they're getting sick. It's definitely one of the reasons that they're getting parasites.
So about a couple of months back, we had a medical camp. We checked the students and found out 95% of them are affected with worms.
The worms will go up and live below their stomach and eat 1/3 of what a child is eating every day will just go to feed the worm. But it's very easy to get rid of worms. The medicine we're going to give you today will get the worms and let them leave your body. You see signs of malnutrition in their skin tone, skin problems, their hair. There is childhood blindness in this area. There's a lot of parasites, so the kids really need the program here. These are the children we need to see. These are the children that nobody else is seeing. I mean, this community, no other medical people are going to be coming out here. There is no clinic, there is no hospital, there are no doctors. So for us to kind of be able to come in and meet these kids, we have a huge impact on their lives. I mean, these kids are really off the radar screen for any kind of medical help. And when they get sick, they just have to suffer with it, and a lot of them won't make it. I mean, especially the younger ones, they won't survive a common infection or a cold or something as common as measles. They can't get past it, and it's just because they're so chronically malnourished. Are there bathrooms in this slum?
It's a common toilet bathroom.
Common toilet. So
yeah, the ratio is 32 toilets for 400 families.
30 toilets for 400 families. Wow. 30 toilets for 400 families. Whoa. We're in Bhimnagar, outside of Pune. There are about 1.5 million people in Pune living in slums. So it keeps getting more and more extreme, and the poverty is just at a level that is hard to imagine anywhere else but India. Anytime we see this kind of condition, we're really concerned about hygiene, we're concerned about water, we're concerned about sanitation, and we're concerned about vitamin deficiency diseases, all of which lead to early infant and child morbidity and mortality, disease and death. And so anytime you see this kind of situation, you're really concerned that these kids, if they get sick or they get dehydrated or they get diarrhea or measles, they might not make it, which is why a vitamin A intervention is critical. I mean, it is essential that you do that in this kind of environment, because these kids don't have much of a chance otherwise. This is pretty bare minimum. I mean, people do not have any kind of water that's clean. There's a lot of excrement all over the place. There's nobody picking up trash, so there's just piles of garbage. No medical help, no schooling. People working for $1.50 a day. So this is the latrine for about 300 families, and not all the families are even covered by these. So this is, again, pretty minimal sanitation facilities here for these kids. There's no showers, no running water. The smell is pretty awful. I mean, it's intense here. It's not the place you'd want to hang out. Oh, we're in this narrow corridor with stagnant water that's contaminated, that has feces in it. With some kind of electrical line that's kind of running right along the ground here. And you can just see that when this place starts to flood during the monsoon, all this is just going to kind of wash right into the people's homes. This is really no protection. So this is pretty bottom of the line here. A lot of work to be done, which is great. A third of the children who are dying every year, the cause is chronic malnutrition. This is something we don't have to invest any money in research. We don't have to spend decades trying to find a cure. We know the solution. We have the nutrition available. We have supplements that can change these children's lives today. All we have to do is to harness the willpower to say, yes, these children matter. These children's lives can be completely changed by something as simple as giving them 2 vitamin A a year.